All right, you know, so many people suffer from headaches and neck aches and ear, maybe facial pain, maybe a clicking in your jaw when you open and close or swallow. All those symptoms could be something called TMJ. It is a very painful condition, but there's help for it. Please welcome Dr. Dwayne Keller from Keller Professional Group and his patient, Lisa Santiago. Thank you both so much for being here. We really appreciate it.
Thank you.
I think, and I'm hoping I'm not wrong, this is a lot more common than a lot of people think.
It is more common than we would normally associate. I think it's one of the things that we're beginning to see affects a lot of people in a lot of ways, especially those people that have headaches, people that have clicking jaw joints. That's usually an indication that the joint's not working well.
So we won't stress too much what TMJ stands for. That's not so important. Talk to us about what the condition is.
There's a balance that exists between how your teeth fit together, how your jaw, then lower jaw relates to your upper jaw, how the joints and the muscles work. When that's in balance, I don't see people. When it's not in balance, then you usually have to have some type of professional intervention or professional help. Lisa was a patient that was being treated by another doctor who got to a point where he became uncomfortable with where he was in treatment and asked if I would take a look and intervene and help with her care. And basically she was having headaches, clicking, limited opening, and pain with that.
Now, Lisa, did you know that you had this TMJ?
Beforehand, no.
You didn't?
No.
You just knew that you had the clicking.
Right, knew
but
I
you
had.
didn't associate the headaches and the other symptoms with the clicking necessarily?
No.
And so you've had, what was the treatment then?
What we do is we find, first off we do examination, find out what the causes are. In her case, she had a dislocated joint. We repositioned that with an appliance. She was in orthodontics at the time. We then found a functional bite position, worked with physical therapists to get the muscles, the head and neck working properly. And then we, after we got her pain-free, we then moved her teeth to support that functional jaw position, and that's where she is now.
And?
And the results are great. I have much more opening and movement, few if any headaches, and the neck pain and ear pain is much better.
Well, you may want to stick around for the Irish dancers if you don't get any headaches, because that'll be a good test.
Yes.
You know how I think of this? I think of it like, because I have been familiar with it, I almost think of it like when you talk to a chiropractor about how the spine has to be balanced and in line, and that they make adjustments in that spine many times in a non-invasive way, which is what you're talking about with us here today, right?
Correct.
And it brings other things into balance, and miraculously something that you would never associate with that, you know, that misaligned column, that's kind of the same thing, isn't it?
Correct. If the components are working as they are designed to work, they're painless, they're noiseless, you have a full range of motion, and the patients don't suffer from headaches, neck aches, earaches, that type of stuff. When you do have that, then TMJ is one of the things that you have to look at.
And it can be treated in a non-invasive manner,
Yes.
right? And make a huge difference in your life?
A huge difference. I would actually be out eating with friends and have food in my mouth and be trying to chew, and it would just stop and get stuck. And so I would just politely not eat anymore, and that never happens anymore.
That's great. Congratulations.
Thank you.
Thank you both so much for being here. If you're experiencing any of these symptoms and problems, or maybe you're thinking, gee, I wonder if these headaches I get or whatever might be associated with some kind of a misalignment in your jaw, you can get help today. All you have to do is call Dr. Keller at 314-638-4190. He'll help you find out why you have pain and what can be done. Or you can always check out his website, drdwaynekeller.com, to learn more about TMJ. Thank you both.
Thank you.